Early civilizations had different ways to understand illness. They often linked it to supernatural forces. People believed spirits or gods caused diseases. To cure the sick, they used a mix of rituals and herbal remedies. These practices, passed down through generations, formed the basis of early medical systems. While not always accurate, they showed a desire to understand the human body and heal the sick. Ancient Egyptians, for example, made significant strides in surgery and public health. They developed surprisingly advanced surgical techniques. Evidence suggests they understood concepts like setting bones and treating wounds. The ancient Greeks, particularly Hippocrates, revolutionized medical thinking. Hippocrates emphasized observing the patient and the disease. He moved away from supernatural explanations for illness. He believed that diseases had natural causes. This approach, emphasizing observation and rational thought, laid the foundation for scientific medicine. His teachings, compiled in the Hippocratic corpus, became a cornerstone of medical education for centuries. Another prominent Greek physician, Galen, made significant contributions. Galen's work focused on anatomy and physiology. He dissected animals to understand the human body. Though not always accurate due to the reliance on animal dissections, his theories dominated medical thinking for over a millennium. His detailed anatomical descriptions, despite their flaws, influenced medical practice for centuries. The Middle Ages saw the preservation of Greek medical knowledge. This was largely thanks to Arab scholars. They translated Greek texts, keeping the knowledge alive. Medical schools in places like Persia and Egypt became centers of learning. They contributed to fields like surgery and ophthalmology. Avicenna, a Persian physician, wrote the Canon of Medicine. This comprehensive medical encyclopedia became a standard text in both the East and West. In Europe, despite the limitations imposed by the time, monasteries played a crucial role in preserving medical knowledge and caring for the sick. Monasteries often had infirmaries. These were places where monks provided medical care using a combination of herbal remedies and religious practices. While medical progress was slower during the early Middle Ages in Europe, it was not entirely stagnant. The Renaissance marked a period of renewed interest in classical learning. This had a profound impact on medicine. Scholars rediscovered and translated ancient Greek and Roman medical texts. This led to a questioning of long-held medical theories. The invention of the printing press in the 15th century revolutionized the spread of medical knowledge. It allowed for the mass production of books, making medical texts more accessible to physicians and scholars across Europe. This dissemination of knowledge fostered a more critical and investigative approach to medicine. Anatomists like Andreas Vesalius challenged Galen's anatomical descriptions. Vesalius performed human dissections and produced detailed anatomical drawings. His work, De Humani Corporis Fabrica, revolutionized anatomy. Section 5. The birth of modern medicine. The 17th and 18th centuries witnessed significant strides in medical understanding. William Harvey, an English physician, made a groundbreaking discovery: the circulation of blood. His experiments demonstrated how the heart pumped blood throughout the body. This discovery overturned Galen's theories and laid the foundation for modern physiology. The invention of the microscope by Antony van Leeuwenhoek opened up a whole new world. It allowed scientists to see and study microorganisms for the first time. This had a profound impact on medicine, though the full implications of these microscopic creatures wouldn't be realized until later. The development of the scientific method, with its emphasis on observation, experimentation, and the formulation of hypotheses, further revolutionized medical research. Scientists began to apply more rigorous methods to their studies, leading to more accurate observations and conclusions. Section 6. Breakthroughs in understanding germ theory and antibiotics. The 19th century brought about a revolution in our understanding of disease. Louis Pasteur, a French chemist, established the germ theory of disease. He demonstrated that microorganisms, or germs, were responsible for causing many illnesses. This groundbreaking discovery transformed medicine. It led to the development of antiseptic techniques in surgery, drastically reducing infections. Joseph Lister, a British surgeon, applied Pasteur's findings to surgical procedures. His work on antiseptic surgery dramatically reduced post-operative infections and mortality rates. This was a major turning point in surgical practice. Later, Robert Koch further developed the germ theory. He identified the specific bacteria responsible for diseases like anthrax and tuberculosis. His work solidified the link between specific microorganisms and specific diseases. Section 7. Technological advancements, transforming diagnosis and treatment. The 20th and 21st centuries have witnessed an explosion of technological advancements in medicine. The development of antibiotics, starting with penicillin, revolutionized the treatment of bacterial infections. The discovery of penicillin by Alexander Fleming in 1928 marked a turning point in the fight against bacterial infections. Antibiotics have since saved countless lives and continue to be a cornerstone of modern medicine. Imaging techniques like X-rays, kinetic scans, and MRI scans have revolutionized medical diagnosis. These technologies allow doctors to visualize the human body in unprecedented detail, enabling more accurate diagnoses and targeted treatments. Advances in medical imaging have led to the earlier detection and treatment of many diseases. The development of vaccines has also been instrumental in preventing the spread of infectious diseases. Vaccines work by introducing a weakened or inactive form of a pathogen into the body, triggering an immune response and providing immunity against future infections. Section 8. The impact of medical science, a legacy of longer, healthier lives. The advancements in medical science have had a profound impact on human health and longevity. Life expectancy has increased dramatically. Improved sanitation, nutrition, and medical care have all contributed to this increase. Vaccines have eradicated or significantly reduced the incidence of many deadly diseases. Diseases like smallpox, which once claimed millions of lives, have been eradicated thanks to widespread vaccination efforts. Medical interventions from organ transplantation to gene therapy offer hope for those with previously untreatable conditions. The development of new drugs and therapies continues at a rapid pace, offering new hope for patients with a wide range of diseases. The focus on preventative medicine, emphasizing healthy lifestyles and early detection, is further improving health outcomes. Section 9. The future of medicine, promising advancements and ethical considerations. The future of medicine holds immense promise. Fields like nanotechnology, gene editing, and artificial intelligence are poised to revolutionize healthcare. Nanotechnology, involving the manipulation of materials at the atomic and molecular level, holds potential for targeted drug delivery and regenerative medicine. Gene editing technologies like CRISPR-Cas9 offer the potential to cure genetic diseases by correcting faulty genes. Ethical considerations surrounding these advancements are crucial. As we delve deeper into manipulating the building blocks of life, questions about safety, accessibility, and the very definition of human enhancement arise. The increasing use of artificial intelligence in healthcare raises questions about data privacy, algorithmic bias, and the evolving roles of healthcare professionals. Open discussions and careful consideration of these ethical implications are paramount to ensuring that future medical advancements benefit all of humanity.